Hi, I'm Dr. Nick Neneman with Neneman Chiropractic Clinic, and thanks again for joining us in our weekly video blog series. This week what I'm going to go over is I'm going to touch on the most important system in the body, the nervous system. As some people know, as all people should know, the nervous system controls everything in the body. It tells tells your heart to beat, it tells your lungs to breathe, it tells your digestive system to digest. It controls everything in the body. And what makes up the nervous system? It's the brain and the spinal cord. A lot of people, when it comes to back or neck issues, all they think about is the bones, the disc. They don't really think about actually what's inside there and what could be going on. So that's what I want to talk about today, and I'm specifically going to talk about the cervical spine, which is the neck, which consists of 7 vertebrae. Going back to what I said, as you know, the brain is protected by the skull, and the spinal cord, which stems down from the brain, is protected by the spinal column. So your spinal column has a very important function. It literally protects your spinal cord and protects it from injury. Now, that spinal cord that comes down, it has nerves coming off at every level. Every level of the spine on the left and right side, there's nerves that come off the spinal cord. They branch out and they go to muscles, organs, tissues. And, as those nerves go out laterally, they have other branches that go to all these areas. So everything in your body comes right back to the brain and the spinal cord. When you touch something that's hot, the sensation from your finger goes all the way up your arm, to the spinal cord, to your brain, saying, "Ow, that's hot, take your hand off." The message comes back down from your brain through your spinal cord, down your arm to your hand, and you remove your hand off that hot item. That's how everything in the body works. It's a relay system from your brain through the spinal cord out to organs back. That's how everything works. So, like I said, I'm going to focus today on the cervical spine or the neck vertebra. Again, the neck is not just vertebra, disc. There's a lot of nerves, blood vessels in the neck that have very important functions. I'm specifically going to talk about the 7 vertebrae, their nerves, and what they control or what they innervate. So first, what I want to talk about today, the C1 nerve. The C1 nerves on each side of the spine, they have very important functions. The C1 nerve, which sits, by the first vertebra underneath the base of the skull, the C1 nerve, it innervates the pituitary gland, the inner and middle ear. And it also controls the sympathetic nervous system, and it also the C1 area also has all the blood, controls the blood supply to the head. So C1, very important area, has a lot of nerves that go to important tissues, organs. The C2 nerve level, that innervates your eyes, your optic nerves, which are the nerves that go to the eyes, the sinuses, your tongue, the auditory nerves, the nerves in your ear. The C3, that controls the C3 nerves. That controls your outer ear, your teeth, cheeks. Innervates some important things there. Your C4, that innervates your nose, lips, mouth. C5, that innervates your vocal cords, your pharynx, some of your neck glands. C6, that innervates your tonsils. C7, your thyroid gland. All these structures I just listed off are very important, have very important functions in the body. Again, it all comes back to these nerves at the spinal cord, in the spine. Very, very important that these nerves are functioning at 100%, so that these destination organs or tissues are functioning at 100%. That's what I talked about last week in my blog, is that by getting adjusted, you're allowing that those nerves that exit the spine, you're allowing them to function at 100%, which can allow your body to function at 100%. Most people come to the chiropractor for pain relief, which, yeah, that's okay. But so many patients that I treat, they tell me, I just feel better. I have a generalized feeling I feel good. I have people tell me they sleep better. So again, By getting adjusted, you can alleviate pressure off any of these nerves that, when those nerves have pressure, they're not functioning at 100%. So wherever those nerves are going, whether it be your tonsils, your inner ear, that structure is not going to function at 100%. So again, another great thing with chiropractic is by getting adjusted, we're going to allow other areas of the body to function at a better rate. Again, because those nerves that go to those areas come right back to the spine and the spinal cord. So next week what we're gonna go into the thoracic spine, which is also known as the mid back. We'll go over that and kind of talk about some of the different, the nerve levels and what they control and what they innervate. So, hopefully you learned something new today. Besides just bones and joints, we're talking about the nervous system here and the nerves, very important functions. So, thanks for joining us this week, and come back next week. We're going to talk about the innervation with the nerves and the thoracic spine. Thank you.